from Sis Heal Yourself. And the reason why I reached out to you, Fatima, I actually think I reached out to you maybe in July during Minority Mental Health Awareness Month. And I just know, as being a Black SLP myself and also witnessing the generations who are coming up after me, the retainment for BIPOC SLPs really sad once we
Mhm.
get to the field, just from my experience and what I've heard from past colleagues. We get into the field, imposter syndrome creeps in, and unbeknownst to a lot of us, a lot of it is generational trauma. And so we leave. We just decide SLP is not for me. I don't know why I did this. Some people can't even pass the certification exam because of those negative thoughts and wounds that we're still trying to get through. So I brought you on here pretty much because your platform says it all, sis heal yourself. And I would love to bring more Black SLPs, BIPOC SLPs in the profession. And I love to take an interdisciplinary approach to it. So I'm going
Mhm.
to go ahead and do your introduction and then we can get into the interview.
Yeah, awesome.
Yes. So Fatima is an experienced social worker and educator. Driven by the desire to transform people's lives, she takes pride in the work that she does. In August 2021, Fatima pursued her dream of full time entrepreneurship and is the owner of Path of Discovery Counseling Services, LCSW, PLLC. Previously, Fatima was a social worker, most recently with the Veterans Administration. She has also worked in community health, pediatric social work, in the Rochester City School of District. Excuse me, the Rochester City School District. In addition to her primary job functions, Fatima is an adjunct professor in the School of Social Work at Nazareth College, where she takes joy in educating and helping to mold the minds of future social workers in the areas of cultural humility and cultural diversity. Additionally, Fatima has a digital platform entitled Sis Heal Yourself, a space that fosters the wellness of women of color with an emphasis on covering faith and mental health. You can find more about Fatima at www.sishealyourself.com and www.pathofdiscoverycounseling.com. So, Fatima, that was such a beautiful, beautiful bio. Is there anything that I've missed that you would like to add?
Um, oh, well, I guess I sometimes don't include, just, like, my personal life, but I've been married for 10 years. I have a 4-year-old, and I'm really, really hoping that she does not interrupt me. But she is, like, the light of my life. I really enjoy being a mom, and seeing her go to kindergarten this year was definitely it's a joy to kinda just see her grow up and just see the world through her eyes. So that's the only thing that I would add. And my name is pronounced Fatima. I know some people say Fatima, which is fine, but I pronounce it Fatima.
Okay, Fatima, thank you so much for correcting me on
Yeah,
that.
of course.
Well, could you tell us a little bit about your why you joined the field of social work, and also how you came up with your business structures?
Yeah. So I really love like your approach to, helping Black people navigate these professions. I started thinking that I was going to be a nurse. So I started school. I declared nursing my freshman year, was in the program, which is important to note because a lot of times you have to apply to get into like a nursing major. But I was accepted into the nursing major my freshman year, was dead set on being a travel nurse, and got all the way up to my junior year, and I was doing assessments, and I was doing like a comprehensive assessment. Like I wanted to know everything about their family and their mental health, and the way that we were being taught was like you really need to focus on the physical symptoms that a patient is having. And so I remember a professor was like, have you thought about social work? And it wasn't that I wasn't doing well in my classes or anything like that, but it was just the way that I was thinking about the clients or the patients that I was working with. And so I took a social work class, I think it might have been like the spring or fall semester of my junior year. And I loved it. Like I was like, this is it. Like this is what I want to do. And so I switched my major to human services. And then I applied for an MSW program my senior year. And um, I just remember like being really passionate about the idea that I would be helping to like liberate my people in whatever capacity. And so I got into the program, my MSW program, and I, graduated, had really great internship experiences, graduated, got in the field, and I was burnt out like the second my second year as a social worker. Like I was like, "What?" Like this is not what I was expecting. And I remember I had gone up for a promotion at this particular job and I didn't get it. And I was like, well, I'm going to go back to school. And so I went back to school and got my master's in public administration and was like, I'm leaving social work. Like I've had it, I'm going to go into administration. And it didn't really work out the way that I expected because my mind frame, not just because I was formally trained as a social worker, but just the way that I am designed is I think like a social worker. Like I always say, I've been a social worker my whole life and I just like got the degree later. And so there was always something that pulled me back to social work as much as I wanted to leave. And I think the thing that helped me kind of fall back in love with social work was finding my place and, you know, working towards building something that I was proud of. And that's kind of what happened with Sis Heal Yourself. It was really out of the desire to kind of have a voice in the space of mental health and also to converge faith and mental health because my faith is important to me. And I was going through some things and I needed an outlet to kind of like talk about that was separate from my personal life. And so Cecile Yourself was birthed, and then my private practice was birthed. And so I think it was really created for two reasons. One, I needed an outlet. And
Yeah.
two, um, having received mental health services myself and experienced microaggressions as a client, I wanted to provide spaces where Black women didn't have to worry about that. And so that was really my motivation. I didn't know that that's the journey that I would take when I got my MSW degree, but I'm so grateful that this is the journey that I'm on, and I'm grateful for every experience that I had because it's really helped me develop, a business and, create something that I'm proud of and that, you know, folks can come and receive quality care. So that's it in a nutshell of kind of how I've gotten to where I am.
Well, thank you so much. One thing that's coming up for me is the fact that Sis Heal Yourself, that your businesses are faith-based businesses.
Mhm.
Can you tell us a little bit from your perspective how faith and mental health go hand in hand?
Yeah, I think they are just really intricately connected. But I think sometimes our faith leaders and our churches haven't always seen it that way. And so we hear things like, just pray about it, or that's just the devil trying to, get into your mind. And like, there's a place for all of that, right? Like, it's not about diminishing or dismissing one for the other, but it's like, how can we connect the two? How can we um, create space and understand how the brain works, right? And how depression and anxiety is actually mental illness. It is not, the devil. It is actually something that people struggle with, and there are symptoms and, things that, people are struggling with. And so, how can we, instead of having the two things fight against each other, how can we make these two things work together? And so I believe that therapy is spiritual work, it's sacred work. And I believe that God sends people to help other people. He created us to be in relationship. And so a lot of the work that I do on Sis Heal Yourself is kind of dismantling these things that we've been told over the years about what mental health is and what it isn't in the context of faith. And I love doing it because I can see how it has not only enlightened me, but how it's like setting people free
Mm.
from shame and guilt and things like that.
I really appreciate that perspective, Fatima, because I am thinking about how a lot of BIPOC people uh, come from these strict religious backgrounds where there's just no space to feel. There's no space
Yeah.
to express. There's no space to feel anxiety. I've spoken with people from Latinx backgrounds that are just like, I didn't have room to be depressed. Depression was not a thing in my house.
Mhm, mhm,
And so even with myself, I found myself teaching my parents about mental health and how
mhm,
their actions are really just a manifestation of mental health that could be addressed rather than just the world maybe being against them or whatever.
mhm.
Let's talk about the populations that you typically serve. So I know that you said it's mainly, is it Black women and pediatric populations as well?
So mainly Black women. I have in the past worked with children. I enjoy working with children. Um, and so I have a group practice. So I have some clinicians who are, willing and open to work with adolescents. We just don't get them. We don't get a ton of referrals. And we also are connected with a lot of other therapists who, work with that population. I personally think that adolescents need to be seen in person. Like that connection is important. And because we're virtual, we primarily work with Black women, couples, and we have, some Black men who come to us that will service too.
That's great. I'm thinking about your platform, how it's called Sis Heal Yourself. Can you tell us a little bit about how, I mean, even the name, I think a lot about self-healing, of course.
Yeah,
So how do you teach that concept?
yeah. So that's a really good question. So Sis Heal Yourself was founded in 2021, and I think, the pandemic kind of had all of us looking at ourselves differently. And I remember talking to a friend about this concept that I was, developing in my head, but didn't have a name for it, didn't have an idea of just like a creative way to explain the importance of loving yourself and taking care of yourself and prioritizing yourself. And it's like, well, sis, you're healing yourself. Like
Mhm.
it's very simple language, right? But it means a lot, like it says a lot. And so on my own healing journey, that's really how Sis Heal Yourself was developed. Like it started out as just an outlet for me, and it grew into something that I truly couldn't have imagined, and has really been, I'm grateful for what has grown to be, because it's been a beacon of light for folks who are struggling with a lot of different things, and I think too, this centering Black women's experience kind of sets it apart from, other pages that might just talk about mental health or might just talk about mental health and faith. We have a unique perspective on all of those things, and so, that's kind of how it came to be. The language is simple, but it's pretty profound when you think about it.
Mhm. It is, and like just like what you said, it seems simple, Sis Heal Yourself, but then it kind of hits you like, wait a second,
Yeah,
that's deep. That's deep.
yeah.
So I do want to talk a little bit about the demographics of our profession. So speech pathology is 92% white. If you're listening to this replay and you don't believe me, go and look at Asha. Asha actually says yes, it is a 92% white field. Can you give us a little bit about the demographics of social work?
Yes. So hearing that, I was actually surprised at how heavily white the SLP profession is. We're doing a little better over in social work. So more than 22% of new social workers are Black
Wow.
and 14% are Hispanic. But still, like, and I think it's good because those numbers they're promising. But in terms of like what we know about the populations that we serve, there's definitely more work to be done. So if we've got 22 who are Black or African American, 14% are Hispanic and Latino, that would leave less than 40% or so are white.
Mhm. But so, I mean, yeah, y'all are doing amazing compared to my profession. Not to just sit here and talk about SLP, but yeah, 22% Black. That's great.
Mhm.
How would you say that that helps? So I know that you are an adjunct professor at Nazareth. So would you does your class mention that at all? How that representation changes their perspective of the field?
Yes. In fact, we just talked about it yesterday. I talk about all the things that people don't want to talk about in
Yeah.
my classes, like, what does it mean to be a white social worker? What does it mean to be a Black social worker? And I think those are conversations we have to have, especially when we're educating social workers. Because at least for me, when I was in school, I had this idea that all social workers thought the same, that all social workers were liberal, all social workers were democratic. Like, that is not the case. And so a lot of times our implicit bias or what we have experienced with different populations really bleeds into the work that we do, and it can be really harmful and damaging. And so I'm really grateful to be able to plant those seeds, um, you know, with emerging social workers to get them thinking about their own privilege and what it means to actually practice cultural humility, what it means to, learn from your clients and how to mitigate power balance imbalances and things like that. Um, it's important not only, when you're in school, but it's important to continually think about that as you go throughout your career. It's really a lifelong journey.
Yeah, no, I do like to say that cultural competency is a journey, not a destination.
Yeah.
So I appreciate you saying that because it's easy to say, well, I took this class, I got my CEU courses, or I don't know what they call it over there in social work, but
Mhm.
I took my class. I already know what assessments I need to do and everything. No, no, things are always changing and there's always more to learn.
Mhm.
So I'm not sure. Now, I know before we went live, we talked about how your understanding of speech pathologists are actually with the students. A lot of people who are in school for speech pathology. Have you had any experience working directly with us?
I have. When I was in the school district, I did a lot of work with speech pathologists for like students that we shared. So, students who had IEPs and were receiving speech services and were receiving counseling. So, we communicated quite a bit around, just the progress or regression that students were having and how we could work together to just make sure that that student was successful.
Well, how exactly did you all work together to ensure that the student was successful? I will be honest and say, not yet have I been able to work directly with a social worker. So I'd like to know.
Mm. Yeah, that's a great question. So one of the ways was more formally was case conferencing. So whenever we would meet maybe like once a month or so and go over cases that we shared. And that was just part of our process in the school that I was working at is we would work with OT, PT, speech. We would all the disciplines would come around the table and talk about different students, and then just determine, okay, this is working well with this student. This isn't going so well, or I might report out like this is what's going on in the home with this student. So you might just want to be aware of like behaviors or something like that. The other thing that, didn't happen often was, like, helping speech pathologists understand, like, linguistic, like, African American vernacular English, or what we know it as Ebonics, or just like some of those cultural differences that can impact language. Um, we would talk a little bit about that. And I personally love interdisciplinary teams. I love to know what is working well. Like let's say that the speech pathologist has a great relationship with that student. Well, I want to know, like, what are you doing to make sure that that relationship is strong? And so I think it was just a great opportunity for us to work as a team, because sometimes when you're in interdisciplinary groups, there can be some power struggles,
Mhm.
um, or there's just like a misunderstanding of what we all do. And so those team meetings really help to clarify everybody's role, but to also just like leverage one another's skills so that the student was getting the best from everyone.
Mhm. I like how at the beginning of that question, you really painted the picture for us how the OT, the social worker, the SLP were all around at a
Mhm.
table. And really, even just how powerful that is when it comes to
Yeah.
supporting one student. And also, I do just want to touch on the fact that there are SLPs who don't understand AAE. And so, again, just speaking to the fact that cultural competency is a journey, you know.
Mhm.
So,
Mhm.
also just wanted to throw that out there.
Yeah.
So, just talking a little bit about your work as far as the self healing concept, have you been able to tie those principles into your practice outside of Sis Heal Yourself?
Yes. So that's really a lot of the work that I do with clients. Is I'm a huge advocate of therapy is best used when you're not in therapy. Like the skills that you're developing are for you to use them out in the real world, because otherwise it's like, what are we doing? Like, what's the purpose of you growing, between the two of us in a virtual space, but it's not translating into your everyday life? And so I love giving my clients practical things that they can do to heal themselves, whether it's, breathing techniques, and I also like to leverage what they're already doing. So I always like to know, well, what have you been doing? And maybe we'll tweak it a little bit, or we will add something. I'm a huge advocate for boundaries. And, how do we have difficult conversations with people that we love? And it really all comes back to how you view yourself. Like, why should you do this for you? Because what I see a lot, particularly with Black women, is that we do so much for everyone else, and then we are left with the scraps. And so I do a lot of work with my clients to help them kind of reverse the order. Like, you can still be present for all of these people in your life that you care about, but what about you? Like, can you pour into yourself first? And then can you give out to the people that you love? And so a lot of it is like trying to understand where they developed this idea that they came last, like really trying to understand that so we can rebuild and redefine some of those things that they've been told, or things that they've developed over time that just weren't in their best interest.
Two, I guess, people who are coming to my mind are mothers that we work with, the families, the Black families specifically that we work,
Yes.
especially when we talk about mothers with disabilities or mothers who have children with disabilities.
Yes.
And I'm also thinking about the Black SLP who is on the verge of burnout or is already there. And
Mhm.
so let me ask you this. When you are giving your clients that advice, what exactly do you say to them that we can take for ourselves as well?
Mm, good question. So I love open-ended questions, or what we call like Socratic questioning,
Hmm.
which is to help you understand why you think the way that you think, or why you do a particular way, or do things a particular way. One of the biggest things that I often ask is like, if a client says, well, I should be Here's a perfect example. Let's say we have a client that's 35 and she's saying, well, at this point, I was expecting to be married and having kids, and I should be in this particular point in my career. And I'll say, okay, the key word for me there is should. So, who told you that you should be at this particular point? Like, where did you get this idea that you had to, have this particular level at 35? And that that almost always is like, like, where did I get that? Who told me that I should be, like, what are the voices in your head? Who are those voices? Because sometimes the thoughts and the voices that are in your head are not yours. So who's in there, and can we replace it with yours? So it's like gentle challenging about like the messages and the things that we do on autopilot because we're busy and we don't have time to sit back and think about like, well, what's in it for me? Um, that gentle challenging really causes one to stop and pause and think about, okay, maybe I do need to examine like why I'm doing something a particular way. And then feel like you can give yourself permission to do it differently.
I like that. Give yourself permission to do it differently. I really like that. I think a lot of times we ask for permission rather than just doing what we feel to do.
Yeah.
So thank you for that. One more question for you, Fatima. Thinking about, again, the interdisciplinary approach, what advice can you give SLPs, or really actually just what vision do you have an ideal future for us to uplift ourselves and also the clients and people that we work with?
So I think one of the big things, particularly for BIPOC professionals like SLPs, social workers, PTs, OTs, nurses, find your people. Like, find your people and don't limit yourself to who's proximal. Whether you've got to find a group on Facebook of Black SLPs or Black therapists, like, do what you can to find a space where you feel empowered and you feel seen, because working, in a field where you're the only often, because I think being an SLP is very similar with being a social worker in that sometimes you're the only SLP or the only social worker on the team. So not only are you lonely because you're the only profession, but you're also lonely because you're the only Black person sometimes. And that can just feel really suffocating. And I can remember just feeling like just so alone and so misunderstood because I wasn't around people who looked like me. And so thankfully, I was able to, one, find my people that were proximal, but then I was able to expand my network to, social workers and therapists who are all across the country. And that's what kind of gives me the fuel to keep going. Because if you're looking for validation or affirmation from a particular group, you may not get it if you catch my drift. So find your people and then just be yourself. I think that works not only for you as a person, but also for the people that you serve. The people that we serve, they can see right through BS. Like, they want you to be you. And I think it's really a great thing where, if a Black person is receiving speech services and they see a Black SLP walk through the door, or they see a Black social worker walk through the door, like, you can almost see the sigh of relief sometimes because they don't have to put on a mask and neither do you. And so yeah, those are the two things I would say. Like, find your people and just be yourself. Don't feel like you have to, be present yourself a particular way for acceptance.
Well, thank you so much, Fatima, for just your wisdom and for sharing with us more about you and what you do. Where can we contact you if we want to learn anything else about you? And even,
Yeah,
I know that there's a lot of people taking notes ready to refer. So,
of course. So you can follow me on Sis Heal Yourself, um, or you can email me. So any, inquiries, you can email me at hello@sishealyourself.com.
well, thank you so much for coming, Fatima. Thank you for anyone who is watching the replay, listening to this on podcast. Please come back next week where we'll be talking to Chelsea Essick about Black SLP magic in November. All right, fam.